Hello, everyone, and welcome. My name is Sarah Donnelly, and today I want to discuss barriers to access to care in rural America. I want to start by talking about a concept called the mortality penalty. In 2008, Cosby described the mortality penalty as a phenomenon where people living in urban or crowded areas have a higher mortality rate than their rural counterparts. This was the norm until about the 1940s, and it resulted from population density, poor water quality, inadequate waste removal, and limited health care and disease control. At that point, the rates evened out due to improvements in health care and infrastructure in urban areas. Over time, the mortality penalty shifted to the rural population. In 2019, Cosby reported that the health disparity between rural and urban populations is large, and it continues to grow. According to the United States Census Bureau in 2016, 97% of the United States land area is considered rural, with about 19% of the population living in a rural area. That's roughly 60 million people. A full range of services and specialties are not as readily available as in urban areas with teaching hospitals, universities, and a large population. The time and resources required to travel for general and specialized care are barriers for those living in rural areas. Health disparities are created if services are unavailable and people are not willing to travel for them. Rural hospitals may be operating on a reduced budget compared to larger metropolitan hospitals. They also do not have the same ability to recruit specialists or retain current physicians. Many individuals living in rural areas are older, with economic hardships. A lack of access to care makes these individuals medically underserved. The United States Department of Health and Human Services created a plan to help improve access to healthcare services for individuals living in rural areas. It's called the Rural Action Plan. This plan focuses on leveraging technology and expanding telehealth services, resulting in more cost-effective delivery of services to those living in rural areas. The Centers for Medicare and Medicaid Services developed the Rural Health Strategy to maximize the scope of practice of medical professionals serving rural and underserved populations. This allows providers to practice independently within the limits of their scope of practice and advance the delivery of telehealth and telemedicine as a viable route for evaluation and treatment, especially for care surrounding mental and behavioral health, substance abuse, and primary care. Harrison's 2019 study on telemedicine showed decreased patient transfer rates as a result of having a specialist available through telemedicine at the hospital bedside, allowing rural patients to be treated locally. Recently, the increasing availability and implementation of telehealth and telemedicine have reduced some of the disparities in healthcare by bringing specialty care directly to a patient via the internet. Healthcare administrators can take action by leveraging technology, designing programs to serve residents of rural communities, and using established communication channels to reach a large target audience. By being proactive about changes in healthcare delivery, health disparities and barriers to access can be reduced for the rural population of the United States. Thank you for joining me today. I've placed my references here on the next few slides for those who are interested in learning more. Have a great day.